My name is Gail Naughton, and I'm best known for my work in regenerative medicine. In 1988, I founded a company called Advanced Tissue Sciences that was focusing on growing tissues and organs, predominantly for the treatment of severe burns and very hard-to-heal wounds. I have always been inspired by the ability of nature to regenerate. It doesn't matter whether or not it's a tree that's been part of a fire that suddenly weeks later is starting to sprout, or how one rainfall can cause an entire desert to come alive, and particularly how you can cut an arm off a starfish and within a few days it completely grows back. Let's talk a little bit about the structure of skin and the importance of growth factors in keeping the skin healthy. The skin basically has two layers. The top layer, which is called the epidermis, whose primary function is to prevent infection and to keep the body covered. The bottom layer of skin is called the dermis, and that's where all the proteins are that give your skin elasticity and strength and structure. And so the role of growth factors are to continuously send signals to the cells of both the top layer and the bottom layer. In the late 1990s, I was extensively studying the role of growth factors in skin repair. And we found that when we were growing our tissue for both burn victims and for chronic wounds, the cells themselves were giving off robust amounts of growth factors. And we asked ourselves, if we took these growth factors and formulated them in a way to topically treat skin, could this go and actually improve the appearance of the skin? And it did. And this is the discovery that led to Neurocell, which is the critical part of TNS. One of the most exciting things for me about being a scientist and an inventor is that I can always learn from what I've done in the past and try to improve it. So when I was looking at what we did with TNS, I said, how can we make this better? How can we not only increase the amount of growth factors in it, but actually get the cells to secrete growth factors that stimulate stem cells in the skin? And that's what led to the discovery of Regenica. Let me tell you a little bit about the unique manufacturing process that we use at Histogen to make Regenica. We take young, healthy skin cells and we place them on beads, which is floating in a liquid that is nourishing them, basically a Gatorade for the cells. By mimicking the embryonic environment, these cells then start to secrete a variety of growth factors that we collect, concentrate, and this is the core ingredient for Regenica. One of the things that I've been inspired by is how during embryological development, nature has a way of having the skin grow, but if you do extensive wounding, be able to heal completely without a scar. I wanted to learn more about this, and so I started to go and mimic the conditions that nature uses during embryological development by growing our cells under very low oxygen and basically floating in culture. And what we found out is that under these conditions, the cells actually go backwards. They become multipotent stem cells instead of just the normal mature fibroblasts. And these multipotent stem cells then secrete a composition that's very unique and that's rich in growth factors and other proteins that are known to stimulate stem cells and other cells of the body. Regenica contains a variety of growth factors, some of that are found in normal skin and some that are unique because they actually stimulate stem cells not only in the skin but other parts of the body. The main growth factors of Regenica are the growth factor that stimulates the top layer of skin called the epidermis, and this growth factor is called keratinocyte growth factor. Another growth factor which stimulates blood flow and new blood vessel formation, so you have plenty of nutrients going to the skin to keep it healthy, is a growth factor called vascular endothelial growth factor, or VEGF. But very unique to Regenica are two growth factors that have been shown scientifically to stimulate stem cells in the skin and other parts of the body. And these two growth factors are called follistatin and stem cell factor. Two formal clinical trials were done using the post-resurfacing Regenica gel. In the first trial, after laser resurfacing, patients received either the Regenica gel with the growth factors or the gel itself. What we saw was quite interesting. Patients using Regenica showed visible signs of healing much quicker, particularly less redness and less crusting. They also complained less about the discomfort. And this directly correlated with the reduction in the amount of petrolatum that they used to relieve the discomfort. So based on this, we designed a second, even more rigorous clinical trial. In the second trial, after laser resurfacing, patients treated half of their face with the Regenica gel and half of their face with the gel without growth factors. Again, we saw the same results. Reduction in redness, reduction in the crusting, and just a quicker overall time to healing with the Regenica. In our third clinical trial, we assessed the anti-aging properties of Regenica. Patients were given either the base cream itself or the cream with the growth factors, of course, the Regenica daytime and overnight products. What we saw is that patients who were treated with the Regenica products saw visible signs of anti-aging. This translated to more even pigmentation, greater skin elasticity, less tactile roughness, and an improvement in both fine and coarse wrinkles. It was great fun talking to the subjects in the anti-aging trial because they would come up to us and say, "We know we have the active product. I feel radiant. I feel glowing. My husband is giving me compliments that he's never given me before." So it was really fun when we unblinded the study and saw that, in fact, those patients that received the Regenica were the ones that had the greater overall feeling about the difference that they saw in their skin. It's great to hear back from people who are using the Regenica products. I have friends who say they would die without it because they look so much better, but I have one favorite story. And this is by a woman, oral maxillary surgeon, who came to me and said, "I so love the product that you invented." And I said, "Well, really, why?" She said, "I've been married for 30 years. And my biggest critic, my mother-in-law, gave me my first compliment last week. She said, 'Your skin looks good. What are you doing different?'" That made me laugh. One of the things I personally love about the Regenica anti-aging products, and something I hear a lot of other people say as well, is that the product has a lovely scent and a very silky texture. This is not true of other products that contain growth factors. I'm often asked by physicians, why should I recommend Regenica to a patient? And for me, the answer is very simple. First of all, it's been proven to be safe and effective. Second of all, there are decades of research behind the composition of growth factors that is in Regenica. Building on what we knew about the science that became TNS, we have worked to make a new and improved composition to truly mimic all of the growth factors and proteins that are part of young, healthy skin.